Hello everyone, welcome back to channel. So we will discuss the basic idea or study design of various studies like case control, cohort and retrospective cohort study. Now this is very confusing, so yeah, let's get started. First, start off with cohort study design. Now this is also called as prospective study or forward study design because we are going forward in time. We are proceeding forward. Say we select a cohort. Cohort is anything but a group of population having the same characteristics. Now that we have a population, now we sort them into exposed group and a non-exposed group. Exposed individuals, say they have been smoking, so they develop lung cancer, whereas there are some who despite being exposed do not develop the disease. Again, we divide the non-exposed group, that is the individuals who don't smoke, still they develop the disease cancer, and again those who do not develop the disease. So the basic idea, it's pretty simple. Cohort is we are going ahead in time. Now that retrospective cohort study, we go back in time. We check the past records and we select a cohort. Say at present we are in 21. So we'll check all the past records of 2010 of medical records of the cohort or individual. So we'll select a cohort. Now from these record, we'll start the follow-up. We'll see how or when they were exposed to what agent or risk factor. Then again, for a few more years, we'll do the follow-up after the people have developed the disease. So in 2010, they had no disease, but we saw their records, their test, and we came to know, we did the follow-up and we realized what they were exposed to. Then again we did the follow-up and then we saw the cases or sorted the cases, individuals who developed the disease and those who didn't. So again we are yes tracing back to 2010, but still we are proceeding forward in time. So that's retrospective cohort study. And last but not the least, we have case control study. In contrast to the cohort study, in case control study, the disease and exposure has already occurred. The patient is suffering from the cancer. We have the cases, that is individual with disease, and we take the controls, that is healthy individuals. And again, we divide these cases and control individual into exposed and non-exposed group. So we find an association between the risk factor and the disease by comparing these cases and controls by this case control study. So how do we come to know about the exposure? Here we are taking the history. In cohort study, we were taking the medical records and test, but in case control study, we are taking the history about the exposure. So that is, we are going from 2021 back to 2010. We are taking the history. We are going back in time. So that is why known as backward study, whereas cohort study is known as forward study. So it's very important that you understand the difference between this study and the designs. And whenever you get a question on classification of these epidemiological studies, so make sure you draw these designs.